Good evening. This is Dr. John Bennett broadcasting from Miami. Tonight we have another in the series of Parkinsonism educational hangouts with Dr. Abdul Rana, neurologist and noted Parkinsonism educator from Toronto, Canada, up in the wilds of Canada. Good evening, Dr. Rana.
Good evening, Dr. Bennett.
Okay,
how are you this evening?
Very, very good. Okay, tonight we're going to hear about autonomic dysfunction and cold sensitivity. I'll start off first with a question. How does excessive cold sensitivity occur in Parkinsonism?
It is not a very common complaint, but it does occur time to time. We see patients. A small number of patients may say they feel excessively cold. So they might come to a clinic. They may be wearing winter clothes in summer and feel quite cold. Autonomic nervous system, because it controls the body temperature. So there are reports suggesting that the abnormalities in autonomic nervous system are responsible for the excessive cold sensitivity. And these patients, sometime if it is severe, they may feel worse.
Okay, what can it lead to?
Some patients report that their tremor increases when they feel cold. So because of the feeling of coldness, so they could be shivering or trembling, and if they have tremor from Parkinson's, that could make it worse. And some of these patients, they would stop going out, and especially in Canada, where we have quite severe cold from November to March. So these patients may feel as they're living throughout the year in the winter season. I had a patient who was brought by her husband, and she was shivering, quite shivering, and it was July, and she was wearing a thick winter jacket, and still she was kind of clinging to herself, quite shivering. And the husband told me that, Doc, what went wrong with her? She's wearing the winter clothes, and she's shivering all the time, and she has heat on in the house, quite a high degree. And when I looked at her, she appeared a bit, you see sometimes patients who appeared kind of catatonic, like kind of clingy to herself. And so when she relaxed and I examined, by the end, when she started feeling comfortable, we noticed a resting tremor in her and some symptoms of Parkinson's. And this is how we realized that this could be a presenting symptom, although it's a rare symptom, but it could happen that patients start feeling quite cold, and then the family physicians realize that there is something wrong neurologically, or they notice a tremor or something, and this is how patients could be referred.
Can something be done about this cold sensitivity?
It is a difficult symptom to treat. We don't have much experience with medications because it's a quite infrequent symptom, and I'm not sure if this would respond to dopaminergic medications. I don't know what other physicians would think, but I think the first thing in these patients is to rule out any other causes, such as hypothyroidism. I had another patient from which I learned my lesson once. So she was feeling of excessive coldness. She was not that severe as the first lady, but she did feel excessively cold, and she was not comfortable in summer. And I assumed that this was due to Parkinson's, because she had known history of Parkinson's. So I just happened to check her thyroid function, and then her thyroid function came back abnormal, and I realized she had a hypothyroidism. So then we referred her to endocrinologist for further assessment, and I realized that we should not assume things unless we're sure. I was first assuming that it could be just due to Parkinson's, and we could just reassure her. But when she was treated for hypothyroidism, she started feeling much better, and her feeling of excessive cold sensitivity just went away. So mostly in these patients, ruling out other causes such as hypothyroidism or any other electrolyte abnormalities. I'm not sure if they would lead to excessive cold sensitivity though. So reassurance, dressing properly would help.
Okay, that wraps it up. Is there anything else to add to the topic of cold sensitivity and Parkinsonism?
I think it's a infrequent symptom in Parkinson's, where it could be quite disabling because patients, they start going out, they stop going out. If it is a little bit cold weather, they would feel excessively cold, they stop going out. This affects their overall health. They would stay in the house with heat on, and they would gain weight, lack of exercise. So it could have some negative impact on patients' quality of life.
Very good. That wraps it up for cold sensitivity and Parkinsonism. Stay tuned for another educational video. These all can be seen, by the way, on Parkinsonism.tv. Thank you and good night, Dr. Rana.
Thank you, Dr. Bennett. Good night.